Hi, good evening. Today I'll be doing my second video about colon and rectal cancer. I hope you enjoyed the video that we did yesterday explaining about colon cancer and its prevention by doing colonoscope. So what are the symptoms of having a colorectal cancer? The first thing to remember is that most patients may not have any symptoms. And when they don't have symptoms, you can pick up the cancer fairly early. I always remember this friend of mine from church. He was from the US. He was 50 years old, no symptoms at all. At 50 in the US 10 years ago, people used to go and get a colonoscope done. And when he went to get a colonoscope, they found a sigmoid or a large bowel cancer. And he went for surgery. He did not need any chemotherapy. And he's passed more than 15 years without a recurrence of the cancer. Now that's an early cancer that was picked up by doing a colonoscope at the age of 50. Now when they have symptoms, what are the symptoms? One could be blood in your stools, bleeding as you go to the toilet, and you see sometimes with mucus. Two, there could be narrowing of your stool, which is slightly different from what it was previously. Or another symptom could be sometimes having loose motions, diarrhea, sometimes having constipation, what we call a change in the bowel habit. For some people, they may be having symptoms of anemia. Suddenly they say, oh, when they go for their blood check, their hemoglobin is not normal. We know the normal hemoglobin tends to be about 13 or 14, but here it becomes less than normal. Unexplained weight loss, suddenly they're losing weight. Some people feel like a small swelling or a mass in their tummy. I'll tell you a story of a lady who saw me during the pandemic, and she had a swelling. She could feel it. And then she came to see one of our medical officers at our health screening center, ultrasound done, and said there is a mass, but she did not go for a colonoscope. And later when we did a CT scan and a colonoscope, we actually realized she was already in stage 3. So these are much later stages, making it more difficult to do surgery. Other things that sometimes which are less often, just like feeling of bloating or crampy pain, or as the Malays will call it, angin. So when we have these symptoms, you must go see your doctor. But of course, the best thing is to go get screened even before getting the symptoms, because what we want to do is to prevent colon cancer, not just to treat it. It's my passion that more Malaysians will get screened as they reach the age of 45 so that we can prevent colon cancer. Have a good day.